So good afternoon, everybody. I'm the co-lead for RPIW 51 in Directory Services, and I'm also the VP of Clinical Support Services and Quality Performance for the region. This is the order that we're going to speak in. We're going to speak to a TAC time of 20 minutes. Here's our fabulous team picture. We are the hopeful game changers. And you'll note a few of us have our eyes shut, but we weren't tired. It was just a little sunny out. So our project was in Directory Services, and the project was to eliminate the error of patients presenting at registration who are not on the appointment list. So you've seen our team. We also had a couple of consultants, which helped us out greatly. One was Dr. Jamie Harris, and the other one was Alona Matthias, and so we certainly appreciate their help. Our theme for the project is to have the right information at the right place at the right time to meet the patient's needs and get the patient to the right place. What we want to happen is patients attending appointments at hospital are on the appointment list when they arrive at registration. And so what we found was that through our work, every day about 5 patients are not on the appointment list. That may not sound like a lot, but it really does have an impact on the flow of patients, which you'll see in a few minutes. So when a patient isn't on the appointment list, the flow is really disrupted, and staff have to investigate to figure out where the patients are supposed to go. The registration clerks make numerous phone calls to determine where the patient has an appointment. Then the patient waits, and then other patients in the line also wait. This causes a delay and frustration for patients. They may be late for our appointment, and they may also wonder about the quality of our service. As this is their first interaction with the hospital, they may think that we're disorganized. Patients may already be anxious, and the delay just increases their anxiety. So our baseline target progress report, I'll just point out a couple of things. Our quality was our defect, which was our 5 patients per day. And we also would like to point out the 5S we did. I don't know if anybody's ever been in registration, but it's a pretty confined space. There's not much room in there. And there was some unusable space in the office of about 21.36 square feet, so we addressed that. This is our time observation sheet that we use to do our value stream map. And pretty much in registration, things usually work pretty well most of the time. There's, as you can see on the value stream map, there's not a lot of wait time. It's about 21 seconds, and that wait time is when the registration clerk confirms the patient appointment. Our lead time is 2 minutes 31 seconds, and our cycle time is 2 minutes and 10 seconds. So it really is a pretty efficient process when it's working well. You can see our value-added time is 86%, and non-value-added is 14%, which, as we know in Lean, is a pretty great start. We also have a number of improvement opportunities, and those are the Kaizen bursts you can see. Things like patients who don't present with their paperwork, patients who aren't on the appointment list, and the add-ons after 4 p.m. that are not on the list. This is our percent load chart. And this is where you can really see what goes on. It's a great way to illustrate being on the appointment list and not on the list. On the left-hand side, you'll see what happens when a patient is on the appointment list, and that takes 2 minutes and 31 seconds to register a patient. On the right-hand side is what happens when the patient is not on the list, and that's taken 13 minutes and 2 seconds. So, you know, it's very visual, and you can see that it's about 6 times the amount of time when a patient's not on the list to register them. Here's a spaghetti diagram, and it just illustrates what happens when a patient's not on the list, the number of phone calls the registration clerks need to make, and some of the walking back and forth to triage to talk to the emergency nurses. Here's just another illustration of the registration process, our standard work combination sheet. And for our registration process, our TAC time is 5 minutes and 26 seconds.
My name is Chandra and I work in client scheduling. Before implementing our change, all patient bookings from physician offices were faxed to client scheduling, including after-hour add-ons. This was one factor contributing to patients not appearing on the appointment list. An idea sheet suggested that by having the bookings sent to registration after 3 p.m. when they were added on to the following day, decreases the chance of patients not being on the appointment list. The following morning, client scheduling will pick up the after-hour bookings and enter them for the current day. By creating a process map of the before and after implementation, this process leaves little to no opportunity for after-hour add-ons to be missing from the appointment list. To support this process, we have also developed the standard work.
Hello, my name is Tina, the happy volunteer and equally happy patient rep. I've had the privilege to be part of a really awesome team, the Hopeful Game Changers. Thank you for the opportunity to hopefully make a difference. One problem our team discovered was that some patients arrive at registration without an appointment card. This slowed down the patient flow as extra time had to be spent tracking and phoning to get the patient to the right department. In this regard, our team visited a walk-in clinic, specialist office, and physician's office to discuss the need and function of appointment cards, as well as discussing the 48-hour policy for booking. We were encouraged that all business managers and medical office assistants agreed and understood the urgency for our suggestion and, in turn, receptive to work with our team. To date, we received one appointment card at registration from one of the offices visited. We call this game changer success. To further bring our plan into action, a memo was developed to circulate in all walk-in clinics, physicians, and specialist offices, reminding them of the 48-hour policy and the need of using appointment cards. Working together, we see this as a positive step to registration improvement.
My name's Ashley and I work in registration. We made a standard work because we were finding that patients were presenting to registration without being on the appointment list. We find it to be time consuming for us and frustrating for all the patients and also all the other departments. We made a standard work to help patients to get to where they need to go in the quickest and best way possible.
Hi, my name is Boris. I work in the CAS Clinic. We worked on a work standard for both CAS Clinic and CAS Room. This is an area which created delays at registration due to patients not having booked appointments. We were working on getting patients booked into Health Suite, getting patient information to registration for new consults, and having information for the follow-up appointments. Our goal was to contact registration or book these appointments to decrease the incidents at the registration desk and related departments that were involved. This should decrease confusion at both staff and patients and increase trust from the patients.
Good afternoon. My name is J.D. Miller. I'm currently in lean training, so I was participating as a participant in this RPIW. I'm also the Director of IT for Athabasca Health Authority, which turned out to be handy in our particular case, because when we went to the registration services and asked what type of patients are presenting and what they're bringing to or not bringing with them when they present to registration, a number of them were identified as First Nations. So when First Nations are coming from the north to the hospital here, they're bringing with them a voucher that a medical transportation clerk would give them from their hometown. And they bring those down here, but they don't have any doctor information. It has appointment information, etc. So what we did was I contacted the Black Lake Clinic and talked to the nurse in charge and also the medical transportation clerk. And what we did was we went through the process and figured out a solution. So what we did was we created a package that will now be given to the patient, which includes all of the vouchers that are required, plus either the referral letter or appointment reminder, and they're being instructed to bring the entire package with them to registration, so hopefully this will change that. So this makes our RPIW probably more unique, possibly, because I don't know the previous 50, because we actually created standard work for another health region with their cooperation.
My name is Leah, and I work for Dr. Martin's orthopedic surgeon. We found patients who were having issues finding the orthopedic and therapies department. We created instructions for the admitting and registration clerks to provide to patients to assist them along their way. We put new signs as well as green rectangles along the wall in the same color as the instruction sheet. The original sign on the wall was very small and out of eyesight. The new signs are bright and catches your attention and now draws you in the correct direction to aid patients to get to the correct department in a timely fashion. We tested our directions by following closely behind patients who were given the instruction sheet. We found the directions we implemented were a great success in wayfinding for patients.
Hello, I'm Michelle Perk-Suter, and I'm a team manager in long-term care at Bassett Home. I am a lean leader, and I'm participating this week as part of my recertification process. So during the RPIW, we found more ways that we could potentially improve wayfinding, and when we walked the path of the patients down to the therapies and orthopedics, we felt we were missing some signage, and also there was some things blocking their view. This was one of the things. As soon as you exit the elevator, you would look at the stop sign of the hand hygiene station, which is very important, but can also be accessed if it's moved 6 inches to the left. It can still easily be seen from the elevator as well from the folks coming off the stairwell and leaving the cafeteria. When we moved it, this is what you can now see. So this was already here. What we did though was we changed the color of therapies and orthopedics to match the patient wayfinding directions that we gave them, and changed the names just slightly. I think it said orthopedic clinic, but on the patient information it says orthopedic, so we changed them to match exactly what their instructions were. Some feedback resulted in more changes of signage, and someone pointed out that there was a sign hanging that said elevator, but there was nothing for those that might require more than just the word. So we found one that had included the picture in order to help those folks. Prior to 1 o'clock today, the sign outside of registration said admitting registration. And this was a deterrent for some folks to stop there because they said, oh, we don't need to stop here because we're not being admitted. So it would result in them going to other departments where they probably were going to end up, but would be sent back because they had not first registered. Now it shows you that you will register there if you have, if you are indeed there for admission, but also for appointments and tests. Emergency, we added the red carpet because that's what we're asking the volunteers to direct patients to stand on when it's an emergency. We did a little bit of changing to the map. As you can see on this one, the colors are lined, and also it shows every little door in the department. And we decided that once the patient, they just need to get to the department and can be directed from there when they arrive. So what we did in the next picture is just made it a bit bigger, changed the colors to solid blocks, made sure the washrooms and the elevator signs stood out. And we did this it's still a two-sided page, and we did the same for level 2. Here you can see that beside the ortho and therapies sign, just outside the cafeteria, there was already this level 2 main floor sign, which was down on level 1, but there was no level 1 sign to show that level that you were on or where you were at the time. You can't see it too good in the picture, but we've got a matching green dot there that says you are here. So we're finding that some people were, actually quite a few people were bypassing the information volunteer desk. So to alleviate unnecessary stops at switchboard and to create a more direct flow for the patients to registration and their appointment locations, we moved the volunteer desk, as you can see in the next picture. The purpose is to decrease wait times for patients unnecessarily lining up at switchboard for things the volunteer could have told them. And also that in turn will free up time for the switchboard clerk to help with registrations as, when there's a bottleneck in those lineups. It's really about decreasing the wait time for patients and also in turn to alleviate unnecessary stops at the volunteer desk. We put this on the switchboard window, need a room number, ask here. So that should help as well.
Hi, I'm Jennifer Sigrad, and I was the other co-lead for this RPIW, and in my other job, I'm a manager of the mental health outpatient department. So our 5S evaluation for this project focused on the switchboard area of directory services. We had a pre-Kaizen score of 1.64 and a post of 2.75. The strength of this 5S project was the sweeping, simplifying, and sorting of the switchboard contact numbers, as well as how the numbers were housed. So prior to our 5S, the majority of the phone numbers were taped with multiple layers of postal packing tape onto the desk. And this created challenges both with readability as well as hygiene. So the project resulted in our very helpful process owners redoing the contact numbers in a color-coded department way in a larger font, and then we also covered it with a heavy plastic tablecloth-like product so that it can be easily moved up and down and not impact the readability. We were also able to increase the unusable space by the construction of a standing workstation where employees are now able to stand and do their evening census and mail work. And this is done in a template because we want the staff to be able to use it for some time and provide some feedback as to whether, how usable it is. And then Pat and I stumbled on our own mistake proofing project because as we were doing these improvements, we accidentally switched the paging system off for the hospital. And so, using the feedback from one of the registration clerks as well as the KPO, we have now installed a mistake-proofing medicine cup over the switch to hopefully reduce that accidental flip-off. Our post-time observation and standard work combination sheets support the fact that, again, when this process is working, it is very efficient. But we have seen post-Kaizen an improvement in the registration process cycle that we have related to the new label armband printers that are now located right on the registration clerk's desk. And this was a quality improvement activity that was currently in process in this department. But it definitely has reduced the walking time for the clerks as well as the lead time. Pat had shown how our percentage load chart, here's the standard work combination sheet showing that we reduced it from 2.31 minutes for the lead time to 2.7 minutes for the lead time. Our percentage load chart, as had shown before, the difference between the process working well to when there's a defect when the person's not on the appointment list. We did see a reduction in this defect cycle time from approximately 11 minutes to 6 minutes. As the team has explained, we excitedly relate this improvement to a change in clinic practice, where after the team made their house call regarding policy and practice of appointment cards, a client attended a registration with exactly that golden ticket. The spaghetti diagram, much simpler than pre-Kaizen, shows two examples of where one of the defects required only 2 phone calls to be made and none in the case where the appointment card was presented to support where that patient needed to go. The new standard work that Ashley described assists the registration clerks in making this defect process as efficient as possible. So we were able to complete the majority of the newspaper items. We do have some multi-skills checklists to complete. We want to take some time to evaluate the workstation. Dr. Harris has graciously offered to speak in the fall at a regional medical association meeting, as well as at his own study group regarding the outcome of this RPIW and to support the actions of the memo, which Pat and I are also going to work on with the SMOs. So our target process sheet summarizes the highlights of this RPIW. We were able to increase the unusable desk space by 100%. Again, keeping in mind the slight adaptations that might need to be changed. We did see a slight reduction in inventory with the 5S, but as this wasn't the primary focus, not overly concerned about that because there wasn't a lot of non-value items in that area to begin with. We saw an approximate 60% reduction in walking distance and parts traveled as a result in the new desk location of the printers, as well as, again, that slight reduction in lead time for the same reasons. This is the best part. 50% reduction in the time it takes to process a defect, which would give us 140% increase in capacity to manage the defects. Woo! And though, the focus of this RPIW was quality and to reduce that defect. And over the week, we did see some reductions in that defect time. However, as we did not receive any add-on after-hour faxes, which isn't a bad thing, we just feel that this measure really is something that needs to be tracked in the audit process, given the short period of time for the trials. So our future value stream map, I think we can confidently say that the majority of the starbursts, particularly the opportunities for improved wayfinding for patients, communication challenges between care providers, the add-ons for 4 p.m. after 4 p.m., and the medical appointment packages for the northern, rural, and remote clinics were addressed in this RPIW. As a result of the previously planned improvement work in this department, the lead time has also improved slightly. It is our hope that this project has helped make this the experience that for all patients who attend for their outpatient appointments at the hospital.
This is our workshop summary. Here are the highlights that we noted. We achieved quick results. Small changes can be effective. Other departments greatly affected the work of frontline staff. Having the right people at the table impacts the process and outcome. Little things make a difference. Keep information plain and simple. Better understanding and appreciation for each other's role in patient care. And we are all amazed at how everyone cares about the patients and has a passion for improving their experience.
Many people help with this RPIW, and we greatly appreciate your help. I want to send a special thank you to our patient family representative, Tina, Dr. Harris, and our coach, Tim.